Okay. We're on, you guys. Welcome. For
Hello.
those of you just joining us, my name is Megan Robles from the Greater Salina Community Foundation, joined by Chris Laheka, also from the Greater Salina Community Foundation. Chris works in our donor services department. And our guest this hour is Sherry Dryden from the American Red Cross. And we just can't wait to hear about what they have going on over there. So, good afternoon, Sherry. Thanks for hopping on to chat with us this afternoon.
Thanks for having me. This is great.
Yes, thank you, Sherry. And can you guys hear me okay?
Yeah.
Awesome. Well, hey, Sherry, if you could just give us a quick update, a general update on how everything's going your way.
Well, I would start off by saying thankfully and gratefully. Reasoning is because each day people still rely on us to help them on prevention and alleviating their suffering. And we're grateful to our volunteers and employees who work tirelessly to support those that we serve. And also being thankful to our generous donors who make the Red Cross mission possible. As everyone's well-being is our top priority, we continue to work closely with public health officials to deliver our services safely and coordinate our efforts, of course, with government health officials and also our partners. And this means that as the coronavirus changes and affects our communities differently, our services may look a little different in each area to ensure we're aiding the local families where they need us most. So, as communities have been following these stay at home orders, and as those orders start to relax, the risk, of course, for disaster still has not changed nor gone away, of course. Since February, when the coronavirus outbreak began to escalate in our country, Red Cross workers were still there. And locally, specifically for Saline County, we had 4 disasters and 7 single family fires just in these past 2.5 months. So for our chapter, which is the Central and Western Kansas chapter, overall we had 18 disasters and 23 single family fires in 2.5 months. So to help keep everyone safe and follow, of course, the social distancing guidelines, our volunteers are working with local fire departments and emergency management to connect with families, either by phone or video calls, offering, of course, that sympathetic ear, but linking them to available support, such as providing hotel stays and, of course, emergency financial assistance. And then to kind of sum this part up, in the beginning, we saw also an unprecedented number of blood drive cancellations, which resulted in hundreds of thousands of fewer blood donations collected across the nation. But in times of crisis like this, the Red Cross, of course, is fortunate to witness the best of humanity as people across the nation, and of course here locally, heard about our critical shortage, and many rolled up their sleeves and filled in the gaps. And of course, we want to say thanks to those who have donated blood and continue to schedule upcoming appointments. Of course, we also continue to provide COVID-19 safety tips, online courses, free mental health courses, and also continue training on resuscitation, CPR, first aid with social distancing. We also have another service a lot of people don't realize, and that is the services to armed forces. This also includes supporting military, service members, veteran hospitals. Just today, I took a donation of homemade masks over to the Salina VA Outreach Center. So we're so blessed by the volunteers that we have. And from this, I do want to point out we have 5 lines of service. We have the biomedical, we have disaster, we have training, we have services to armed forces, and of course, international services. So that was one big breath.
Wow. So, one question I'd like to clarify really quick is you said that the blood drive cancellations, your blood supply went way down, and with a global health crisis like this, is I don't know anything about medical stuff. You'd think I would.
Mhm.
I have two brothers who are doctors, but I don't. But is there a connection there as far as needing that life-saving blood when there's people in the hospitals and the hospitals are overwhelmed? Can you talk about that a little bit?
Yes, specifically blood donations, they have a shelf life of 42 to 45 days. And of course, always trying to help locally is our top ambition. And then we also have the platelets. I'm not a medical person either, but my understanding, you're looking at about 5 days of a turnaround that we need to do with those platelets. Now, one of the things we are very proud of is we are a committed partner, a critical partner with the FDA. We are now doing what's called the convalescent donations. So people who have had COVID-19 and of course are back being healthy, those donors have become critical in helping saving lives of those who are going through it right now.
Wow, that's
So we do have to be in constant contact. In our chapter, well, there's 100 hospitals in the state of Kansas. Our chapter alone has about 50 of them, and specifically our own Salina Regional Health Center. So we have to make sure we are matching those needs, meeting those needs, and that we are able to provide what the health centers are requesting. Does that answer your question?
yes, yes, it definitely makes that connection. So that's very cool. Thank you.
Yeah, nice question. That was definitely interesting. Thank you for that, Sherry. What's you've touched on it several times already, but what if you could help walk us through some of the positives that have come from everything going on that you've seen?
Well, our mission, of course, defines who we are and our adaptability. We have our workforce consists of 90% of volunteers, 10% staff. It's our volunteers. We can't say enough of our volunteers. We have to continue to be innovative and adaptable to our daily challenges. Laws, of course, safety. We follow CDC guidelines, and of course, we are regulated by the FDA. And if you think about it, every 2 seconds, somebody is needing blood. And so, of course, these donations are very critical. The other things that we've done to adapt, of course, we have to keep in mind of social distancing, but yet disasters still occur. So a family who may have experienced a total loss of their home due to a fire, even though we may not have that face-to-face connection with them, we are meeting up with them via phone, via like what we're doing. And also we work closely with the local fire departments and emergency managers. We still get them financial support that they will need. We make arrangements and put them in a hotel for a couple of days until they can get back on their feet. So that daily communication that we constantly have with emergency managers, first responders, also making sure we equip our volunteers and employees with new training, with the PPEs that we need to do. That's very critical.
No, that helps. And Sherry, what challenges do you see moving forward with your operations? And go ahead.
Well, we, of course, will always continue to deliver our core blood and disaster relief services to those in need. We have to think about, again, back to disaster services, providing comfort and assistance to those families who have gone through an overwhelming loss. Our caseworkers work virtually to provide casework for the affected clients. We work close with public health officials, like I stated earlier, and we continue to make sure that there is an understanding we're here, we're there, even if it's virtual. That still has not changed our commitment.
That's amazing. And then I guess to kind of tie things up and finish up, what can people do that are listening and want to get involved? How can they give back right now, and what can they do to help in the long term for you?
Well, before I fully address that, I want to give some history here. Many people do not realize that the American Red Cross has a congressional mandate to provide services to alleviate suffering in times of disaster, as our mission states. We also have a United Nations mandate to provide services internationally, yet we get no financial support from these two entities. So, of course, COVID-19 outbreak has posed some financial challenges for us, as it has all of us, all types of agencies who give support to individuals. It's estimated that the Red Cross impact is up to $3 million for our state alone. These funds, of course, help make the urgent investments to protect health and safety in our communities while providing critical support in all of our lines of services. Of course, we need to purchase necessary safety equipment and cleaning supplies such as thermometers, face masks, gloves, and adhere to extensive safety protocols. And we use these funds to support our community blood drives throughout Kansas and support the constant need for blood in hospitals and patients in need. But an example I'm so proud to share was we had a large blood drive just this last week where our goal was 187 units. We collected 208. And we had a high school graduate come and donate in his cap and gown, and his high school challenged the graduating class of 2020, who will not be walking across the stage, to give back. And I get goosebumps just telling this story.
I have them right now too.
But we have several drives. We encourage you to go to redcross.org and you can key in your zip code and people can see the upcoming drives. We also are addressing immediate and long-term needs by proudly partnering, as I stated earlier, with the FDA and working on the Convalescent donations. And lastly, I just want to personally thank you guys for this opportunity, and also to the Greater Salina Community Foundation, their commitment, their compassion to help others in this greatest time of need. And I understand, this is incredible. And it is. Many of us have to ask for more help than what we have been. And I shouldn't say help, it's the support. It is the support. And we're just very grateful for this opportunity. But during COVID, life emergencies don't stop, and neither does the work of the Red Cross. Each day, people still rely on us to help prevent and alleviate their suffering. And as our founder, Clara Barton, stated, you must never so much think as whether you like it or not, whether it is bearable or not. You must never think of anything except the need and how to meet it. So with that, I say take care, be safe, and stay healthy, because we're all in this together. So thank you.
Thank you so much, Sherry. That was a great quote, and one that I actually haven't heard in relation to this time, but you nailed it. You ended us perfectly today. It has been a pleasure. It has been a pleasure having you on to share with us about the needs of the Red Cross. And we're here to be a community partner, and it's our job to amplify the needs of our local organizations so that we can help people give back and help donors give to the organizations that have causes that they're passionate about. So it's all a big team effort, and Giving Tuesday Now is just the platform we had to do it today. So thank you for being a part of this, and we wish you all the best in the next coming weeks and months of crazy time.
Yes. Thanks, Megan. Thanks, Chris. So good to see you guys.
Sherry.
Thanks, Sherry. You too.
And so Chris and I will be back in just 15 short minutes. I believe we have Catholic Charities up next. Michelle Martin from Catholic Charities of Northern Kansas will be jumping on to give us an update about their organization and give you all an opportunity to give back and support what they have going on. Chris, any last comments before we hop off for a few minutes?
No, that was good. Sherry had some nice words to say, a nice quote to finish up with, and there's so much positive feedback from everybody. This is fun.
This is so fun, and you make a great point. So if you're just now tuning in to our interviews. Chris and I have had the pleasure. We started at 9 this morning, and every half hour we're interviewing a different local nonprofit, and we'll be doing that until 4:30 this afternoon. So if you would like to continue to tune in, jump on every half hour until 4:30. We'll be live on the Greater Salina Community Foundation Facebook page, and you can also watch the replays on this lovely Facebook group, Give Salina. We just unveiled this Facebook group a couple days ago to help connect our community even further and help connect those with giving hearts to all of these organizations that we get the pleasure of working with every day. And as Chris just said, they have so much positivity and they're so committed to what they do. And that's what makes this job so much fun, to support people that have so much passion for their work. So on that note, Chris, we'll sign off here and I'll see you in just a few minutes.
See you soon.
All right. Bye.